I am Dr. Anusha, Senior Radiologist. I am here today as Deputy Medical Superintendent of the Lourdes Hospital, Kochi. Post-COVID scenario in India as a whole is totally different compared to the scenario before that. COVID itself was a shock to the whole medical fraternity and the world as a whole. So post-COVID we have come to value many things much more than the pre-COVID era. The health issues of many are lingering, especially the respiratory issues. So they develop chronic cough, shortness of breath, which doesn't go away with COVID. There has been lingering long-term damage in many a patient. Many people have even suffered strokes and heart attacks at the time of COVID due to the other blood effects of COVID. Now all these people seem to have lingering or long-term health problems even after COVID has left us. But these patients require constant care, repeated checkups, and even caretakers at home, and sometimes need to be admitted for acute situations. COVID has opened our eyes to the world around us and to the animals and the other living things which coexist with us on this earth. All of us need to share this earth. So we, with our increasing population, need not encroach upon the animals and their kingdom and their areas of living. So we have to be aware of the living things and restrict to our human inhabited areas so that these cross infections are prevented in the future. The medical fraternity in hospitals has undergone a great change during the COVID time. So in the post-COVID times of today, we are aware how an infection like this can become a pandemic in a very short interval, and the whole world has to change. All the medical facilities have to be streamlined. The hospital has to be prepared in terms of isolated areas, ICUs and all, to cater to the COVID patients or to such infectious patients, so that the general public coming to the hospital is not infected. In spite of this, we have to pay special attention so that our doctors and our staff are not infected. When the staff get infected, our manpower comes down and we cannot deal with the incoming influx of large number of patients. So all this has come into minds of these people. So we are prepared we'll be prepared in a short interval of time to deal with this in the coming days. Lourdes Hospital, Kochi has learned from the COVID infection. We have realized that in any time in the future, we may be exposed to some other infection like COVID. So we have learned to cut our workforce coming in per week so that the whole staff is not exposed to the infection, and thereby we have a workforce to man the subsequent days also. Besides that, we have isolated ICUs and wards which have minimum footfalls from the general public so that they are not exposed to the infection when they come to the hospital. The Lourdes Hospital, Kochi was founded in 1965. Now 58 years of long service has been put past behind us. The Lourdes Hospital and many other missionary hospitals in both Kochi and entire state of Kerala is a shining example of how the community has taken the health care to the people. The deserving lower strata, the fishing community and many other lower strata people have been free to come to these hospitals for medical care. The hospitals that are missionary generally have a policy of love and service. They are not very business minded like the corporates which have come into the medical field in the last 2 decades or 3 decades. Missionary hospitals in many parts of Kerala are almost 80 or 100 years old also. The bigger ones have maintained and have survived in the changing times in medical fields. Lourdes Hospital was established in 1965 by a nun group called the Orders of Charity. It was under the directions of Reverend Bishop Father Attipeti, who envisaged this to give medical care for the coastal people and for the people on the neighboring islands. Over the years, when the hospital expanded and grew, the administration was taken over by the diocese, and then later it blossomed under the care of numerous director fathers, and also with the ongoing care of the Sisters of Charity and sisters from many other orders. Now we have all the basic specialities and numerous super specialities, both surgical and non-surgical. We have other supporting specialities also, which complete the picture to give able care. Over these decades, Lourdes Hospital has grown but has still maintained its motto in love and service. So we continue to give care to all the needy people of both rich and poor classes. The outreach program of Lourdes Hospital is catering to many of the neighboring islands and also to the suburban areas of Kochi city. Thereby, the needy people are given better care than they would have obtained otherwise.